Always great to see you.
Alrighty, so good morning, everyone, and welcome to this week's edition of 1 Million Cups Fairfax. This Wednesday morning, I'm James Lawson. I am one of the organisers here at 1 Million Cups. Thank you so much for joining us. If this is new to you, let me tell you a little bit about what we do here. We are actually part of the Kaufman Foundation, and we work with communities in entrepreneurship and education to increase opportunities that allow all people to learn, to take risks, and to own their own success. Now, we are a national and a local mission. We work towards this mission through creating a consistent educational experience for each of our 1MC presenters nationwide, while also highlighting the uniqueness and value proposition in each local startup community. Now, like most businesses like us, we have our key pillars. Okay, we have four. We do presentations, not pitches. So if you're looking for investors, probably not the best place to come. We look for authentic connections, not networking. We kind of look at ourselves more like a mastermind group than a networking group for sure. We are run for the community, by the community, and we are radically and intentionally inclusive. Now, if this is your first time here, or you haven't been here in a long time, please feel free to go and raise your hand. We will unmute you. Tell us your name, your company name, and how you heard about us. So feel free to raise your hand. You can wave at the screen. You can do anything you want. Who do we have? Really? Nobody?
You have Jan Hall.
Jan's been with us for a few weeks now. We're thrilled to have
Yeah, he's been jumping in and out.
Oh,
James, are just going to cut in because while there may not be brand new people, there are people who are new to our group who have come back 2, 3, 4, and 5 times, which makes them regulars. And I just think it's phenomenal for our group. And,
Agreed.
You know,
Agreed.
They know who they are. And it's super to have them.
So we'll keep moving. If you are new, by the way, feel free to make sure you put your information inside the chat, right? So we can all connect back and forth. Don't forget to do that. Now, also, on your screen, you will see a QR code. Now, this is a QR code. We'd like you to scan it and check in so that the powers that be can see how we're actually doing from an attendance level. As you can see, we are kind of growing steadily, which is rather nice. Don't worry, if you miss it this time around, it will pop its head up again later on in the presentation. But if you can, right now, just go scan it and check in. That would be wonderful. So as I said, this is run by the community for the community, and this is our organizing team here in Fairfax. We are always looking for new people to come and join and help. If you think that's you, if you think you'd like to be part of the organizing team, feel free to let us know. You can drop an email to anyone on the team, Jen or John, and we can have that conversation. And by the way, there's a QR code to check in again, in case you missed it the first time around. So we have 2 sponsors. We have our Mason Enterprise Centre, and I'm going to ask Jen to speak a little bit about them. And we also have our coffee sponsor, which this month is 48 Blocks Fine Candy. So Jen, can you talk about Mason for a minute? And then we'll move to Maria to talk about 48 Blocks.
Absolutely. Mason Enterprise Center is our location sponsor. You can see us there next Wednesday in person and virtual. Will be hybrid. If you've not been to their space, they are a fantastic incubator just off of 66. They have over 100 businesses that operate out of there. They have over 24 mentors now. They just keep adding mentors. So huge amount of bench strength and support for businesses who are scaling and growing there. They have a great event coming up in May. I'm going to drop a link in chat. If you want to learn more, please see Eddie Hill. You have his email there. You can reach out to them. You can also visit their website Again, they've been a fantastic partner. Check out their programming. If you're looking for a virtual space or in-person space, there are still spaces available, just not that many. With that, I'm going to turn it over to Maria.
Good morning, everybody. I am very happy to introduce you to 48 Blocks Fine Candy. At 48 Blocks Fine Candy, we are defining the confectionery experience by proving that candy is so much more than just chocolate. We specialize in handcrafted, small batch gourmet marshmallows and fruit pâtés, including our award-winning Be Kind honey marshmallows made without corn syrup. Our woman-owned manufacturing firm is located in Falls Church and hosts pop-up tasting collaborations with a coffee sponsor on the second Saturday of each month. Our Sip and Savor partner for April is Café Medrano, who will be pairing their single origin Honduran coffee with our specialty marshmallows. We invite you to forget everything you think you know about candy and discover more thoughtful, flavorful way to indulge.
Thank you, Maria. Thank you, Jen. So here's how the meetings work. Really simple, right? We're going to hear from our presenter in a minute. Once they are done, we will move into Q&A. Please keep yourselves muted, but raise your hand if you have a question. Our moderator will then call on you in order where you can ask a question, give guidance, but generally just be very nice. Okay, that's all we're going to do here. So it is actually my real pleasure to introduce Prabhmeet Kohli, the CEO and founder of Novamorph. Prabhmeet's one of my favorite people. She is absolutely amazing. And she has presented here before. She's come back again for a second time. So we are very excited. So Prabhmeet, I'm going to hand over to you for your presentation. When you're wanting to move through to the next slide, please just say next slide and I will move you on. So Prabhmeet, over to you.
Sorry, thank you. Thank you, James. I just realized I was muted and I'm talking and I had a frog in my throat. So that was awesome that you didn't have to hear that. So thank you for welcoming me back here, everyone. And a very good morning to you on this cloudy day here in Fairfax. I am delighted to be back. I have been blessed to have the feedback from you guys, and I have incorporated one takeaway. The main takeaway that I had heard from you guys last time was that I need to focus on one industry and with one offering. That wasn't very clear to you the last time I was here. So the next slide, please, James. Okay, so what is that one thing that we are doing? We are providing AI agents with governance for healthcare operations. So the industry's healthcare operations is the focus, and what we are providing is AI agents that are governed, and I'll talk about what the governance and all of that is. The basic information still remains the same, about more than 2 years in business. First client landed in June 2025, and we are operational across the US. Next one, please. The challenge question for today is how can we increase our introductions to healthcare companies who are looking to scale operations without scaling their headcount? I'm sure we'll repeat this challenge question again later. So I want to talk a little bit about the problem that healthcare is facing today as we see it. They're struggling to scale patient care while staying compliant without scaling headcount or increasing risk. As the patients grow, which is a good thing, but the current existing clinical and administrative staff can't keep pace with that, leading to poor quality in patient care. The administrative workload is more about, hey, I need to make sure the scheduling is right, there's a prior authorization done, there's a pre-visit prep call that needs to happen, a post-visit follow-up. All of these consume a lot of patient time, take away from the patient care. And of course, the risk with compliance. The regulations are very strict, and they are getting more and more tighter. The HHS, which is the Department of Human Health and Human Services, OCR stands for Office of Civil Rights. They are clamping down further on the compliance requirements. And as you try a new tool, that also has to remain compliant with it. So these are some of the healthcare issues that we are seeing in the industry. James, the next one, please. Thank you. Digging in a little deeper into the numbers of it, like how bad is it? So a physician spends only 47% of the time with the actual patient care. So more than half is spent on paperwork. 30% of the healthcare costs are attributed to administrative overhead. And $1.3 billion was spent on prior authorization administration in 2023 alone, which was a jump from the previous year, 30% jump from the previous year. As I mentioned, the pre-visit, the patient scheduling, the post-visit follow-ups are the real time suckers here, and the HIPAA compliance gaps are a major issue. So, having said all of this, what is our solution that we are offering to tackle all of this? Next one, James. So we want to provide you AI agents which will work as co-workers. They are not replacing the current staff. They are helping them so that they can free up their time and look at the high value tasks, which is patient care. And all this other grunt work can be taken over by the AI agents. So the AI agents will handle scheduling and admin. They are built with HIPAA compliance built in these agents. So the costs, which would increase if you were to add more people, is not rising as the same level as the volume grows if you have AI agents with it. It ends up being a consistent, compliant patient experience and saves the staff from their burnout. Next one, please. Now, I know I keep getting this question of what exactly is an AI agent. So I would ask you to think of them as a tireless digital care coordinator in the healthcare space. In a non-healthcare space, think of it as a software robot. It is given a job to do. It is given the right tools to do the job. And it is supposed to be governed because it's making judgment-based decisions. In case of a healthcare digital care coordinator, the job that we would give it to do would be to handle the scheduling. We are not asking it to give a Medicare advice. You're not asking it to give it any healthcare suggestions or none of that. So job is just to schedule, okay? The tools that you could use, we will need access to EHR to make sure the calendar is available, the patient portal and the scheduling system, right? And access to the provider schedule. Again, when you're giving it access to the patient portal, we want to make sure that it doesn't have access to the medical records per se. It has just information about, hey, this patient needs a scheduled XYZ appointment in the next 5 months or whatever, right? So we'll figure that out. It needs some memory so that it can recall prior interactions and context to it. So it just cannot go and, it needs to know which patient and, memory to handle all those tasks. And finally, the governance limits. These are really important because we don't want a rogue AI agent out on the loose doing stuff which is not supposed to be doing. So these are really important. And that's why these agents that we are building are focused with HIPAA aligned boundaries and protecting the PHI, which is the patient healthcare information. Okay. Next one, please. Like I said, focusing on the healthcare industry. So our beachhead market would be health systems and hospitals, student health centers, health tech companies, and Medicare and health insurance brokers. I want to give an example of a student or a community health center. We were recently talking to one of the potential clients, and their volume the daily schedule is like really crazy. Students will book an appointment, they may not show up. They may cancel. And then to top it off, they have tons of walk-ins coming in. So the whole scheduling just gets really disrupted for them. So what these agents will do is do the pre-visit prep call and messaging and saying, hey, are you coming in? What's happening? And after the visit, they can do a post-visit follow-up. Now, we do not want these agents to go out and reach to the student itself if your healthcare center does not want that, right? So we can make it do what you want it to do. But it can prepare the talking points, it can prepare the draft emails so the humans can review it and say, okay, yes, this looks good, go for it. So that way we are making sure it's not directly interacting if you don't want that to do. Our future expansion plans are more of these highly regulated industries like financial services, insurance, and education. I know the last time I was here, I talked about my school district privacy program. We are still doing that, but we are shifting our focus to healthcare. Doesn't mean that I'm abandoning my current client. And we've worked with some of the social media apps also in the past, improving their governance models, making sure they're compliant. So those are some of the areas where we serve in. And as I mentioned earlier, thank you, James, he knows. So why do we want, why Novamorph is different? We are not slapping on governance at the end. We are going ahead with the governance in mind, making sure it's the right thing to do. We are designing for healthcare first. We have accelerators which help you design, manage, and govern your agentic AI workflows. And we are certified privacy professionals, so we have the expertise and the knowledge to say, okay, how do you manage all of that? Next one, please. Just a few examples of what we have seen in our field so far. We have enabled a health tech chatbot company to sign a BAA. For those who don't know, BAA is a business associate agreement. That's a requirement for HIPAA. So every time one entity talks to the other, they need to have a BAA and agreement signed with them so that they're following certain rules to handle the health information appropriately. So we enabled them to be able to sign a BAA with the health tech company so that they can be using these chatbots. So we did a risk assessment fully, and then with the privacy rules, and said, here are the gaps, here's what you need to do to get into a compliant position. We are completed a POC for a prospect, which was a knowledge agent for Medicare customer experience. This was more designed to answer those questions that their customers are asking based on the Medicare documents that are available, so the information for that, and also responding in a tone that is very close to their customer reps. So instead of just answering like a standard chatbot, we incorporated the language and the tone and the experience of their customer service reps. That relationship is important in this case. And the prospect we're talking about, the agentic AI for the clinical administrative task floors, this is one which I talked about earlier, like, hey, the student health center, handling their pre-visit planning, appointment scheduling, cancellation management, so that all of these things are taken off the plate of the medical assistant, and the medical assistants can actually focus on patient care. So we have our regulatory frameworks applied, and we go with that. Thank you, James. It's like, move on. So how do we engage with you? There are two major colors you see here, the blue and the green. And I'm sorry, Jen, I didn't change the colors. I forgot about the blue-green color blindness in this part. But the phase one, discover and design, is more of a strategic part of it, and the build, test, and deploy are the implementation part of it. So we can come in, we help you discover your use case that will make sense to agentify, if I use that term, it's becoming a verb now, and do a risk assessment, help you identify, map your workflows, and give you the compliance requirements. In the design phase, we translate that problem statement or the use case we have identified into an agentic AI design. That'll give you what kind of agents you would need, how would you govern them, what are the privacy policies you need to put in place. So that gives you a design for the agents. because the design part is really important. If you go ahead and build without the design, then you have to do a lot of tweaking and a lot of rework at the end. The build and the test phase is where your agents are implemented, deployed, QA, all of that. And then the deployment phase, where we also put in performance dashboards. In the build and the test phase, we also ensure we have change management included, because what good is a tool if nobody's going to use it? So we need to make sure people are comfortable with it, train according to, and answer those questions. That brings me to my challenge question again. But before that challenge question, we have are offering right now a free 30-minute use case workshop where we will take one of your operational bottleneck, and we will give you a governed design for what the AI agent should look like. There's no cost or commitment, no obligation. We just give you, at the end, you'll walk away with a clear design as to what kind of agents are required, what would be the trust and assurance around it, what should be the operational guardrails around it, and an implementation plan for it. And you can figure out if you want to implement it or not. It's free. If you guys want to explore, let me know. And I know you might say, hey, I'm not in healthcare, but if you want to get an experience and feel for what it would look like, we are here. James, next one. Now it brings me back to my challenge question of how can we increase introductions to healthcare companies who are looking to scale operations without scaling their headcount?
Thank you so much, Prabhmeet. That was a great presentation. And thanks for sharing an example of a lead gen campaign. I know often we end up asking questions. What are you doing for lead generation? So that was helpful. For folks who are new or for our return people, now is a great time to ask clarifying questions. You'll see I put the challenge question in chat. I will drop it in there again. Just raise your hand, or if you wave, I do have everybody up on the screen as well, and I will pay attention to that too. And again, this is all about, given the specificity of what Prabhmeet just went over, where should she be seen? How can she help increase introductions for Novamorph? Basically building not just the awareness, but also the lead generation pipeline. Okay, I'm going to jump in and kick us off with a follow-up question, Prabhmeet, and then we'll go to Rose right after that. For the most recent 3 leads that you walked through, those examples, how did you come about getting those? Like, what's worked so far?
Interestingly, one of them has been from 1MillionCups itself. So that has certainly worked.
Yay. Okay.
Yeah, and the others are more going into the networking events and presenting. So I've been on panels recently, speaking engagements, talking to people, going into where they talk about more about privacy. Now, I know I would love to go is to the healthcare, where the healthcare people meet. That's the next step that I'm looking at.
Okay, fantastic. Just a quick reminder, as we ask questions, let's keep them concise. As we give answers, let's keep them concise. We have Melinda and Maria will be taking notes in chat. So with that, Rose, take us away.
Okay, for healthcare companies, which size do you think are most apt to be scaling operations without scaling headcount? And then my follow-up question is, like, what person in that is likely your first, like, contact? Who do you want to be introduced to in that organization? Okay.
Very good question, Rose, because so I know you had 2 parts to the question, right? So first part was, sorry, I remember the second part now.
Oh, it's okay. What type of healthcare company do you think is scaling operations without scaling headcount, or most apt to want that kind of?
Yes, so it's like the student health centers, because they have a whole lot of transitioning population. So they're every 4 years they have a new batch, right? So every 4 years the students are moving on. So that becomes for them to track their vaccinations, their requirements. All of that is quite a bit. And then anything that's smaller. So these larger hospitals will have an army of people who can make sure that they're compliant, and they will also have possibly more deeper pockets to get more IT solutions in place, or digital solutions in place. So our target is more of the smaller ones. And another reason is most of these breaches that when you look at, or non-compliance, happens with the smaller operations because they don't have those people to take care of that, right? So they don't have the people who are always like, okay, looking at compliance and working with it. So to answer the second question of who would I reach out to? One, so there's two kind of people. One who's actually having the pain, right? They would love to see their workload being easier, but the challenge is they may not hold the strings to the purse. So we need to talk to somebody who is like maybe a head of a medical center, for example, who can work with people and, you know, get some money for funding for this work to be done.
Fantastic. Thank you, Prabhmeet. Thanks, Rose. James Lawson and then John Rittenberg.
Thanks, Jen. Thank you, Prabhmeet. Excellent presentation, as always. So just for clarification, so we have this free workshop that you're doing. Is this something you go into the business and do? Like how can you just very quickly, how does that work? And then how are you going into the market right now to actually promote this 30-minute checkup or use case workshop?
So I'll answer your second question first. So how am I reaching out as more of these speaking engagements at the end? I'll say, okay, we have this, you know, reach out. I can put it on the website, but I mean, not many people are looking for a free workshop on this, and then they'll find it on the website. So I don't feel it's the right fit, but if you think it is, I would put it out there too. So your, the first question was—
Is it in person? Do you go to the business Prabhmeet and do this in person?
So I have both ways. So I can go in person. I have done that and walked in person because it gives them a better feel for who I am and how I operate. And I understand their dynamics a little bit better because they can call in more people into the call and it's easier. I also have had Zoom calls where we can take notes, and if they're okay with us recording the transcribing it, that helps because I need all the information I can get for them to understand their business problems, right? They might say, oh, I have this problem, but if you ask those poking questions and probing questions and you're like, okay, now I understand the problem a little bit better. So that's how I'm doing those.
Okay. I've got another question. I will circle back later on, but
you.
Thanks so much.
Thank
We
you.
love it when organizers follow our own rules. It's helpful. Rittenberg, did you still
Thank
need
you.
to ask your
Yes,
question?
ma'am. I don't know
Please
why
go.
my hand went down, but it went down. Okay, anyway, first, Prabhmeet, thank you so much for being part of our community and presenting twice. It's awesome. So I love the notion of narrow focus, one segment at a time.
Yes, my
And
dear.
the biggest pain
Yes.
point I heard you mention related to the colleges and other community centers where people don't show up and scheduling's a nightmare. And I wonder how many of those exist in America? Like over 1,000, right?
Yeah, quite a few. Yes.
Yeah. And so my thought is define what is the persona of that buyer, specifically in that world. You know, in the college worlds, my limited experience is they're more afraid of risk than us entrepreneurs. And so getting to know them is really requires diligence, and being where they hang is critical. And since you can only be in so many places at once, I'd really test those waters in Virginia.
Okay.
Those are my
Yes.
thoughts.
All right.
Thank you.
Thank you, Rittenberg. I'm going to go to Christine and then Tom Nafor and then Foster. I'll come back to you.
Hi, great to meet you. Thanks so much. I had two different thoughts for you. One is when I hear you talk about the size of the healthcare organization and the strains that they're facing, I also think about nonprofit healthcare providers. You know, everyone tends to think that hospitals and healthcare systems and doctors are all for profit, and they're not. And the nonprofits, particularly in rural areas, are working on razor thin margins. So thinking about nonprofit health systems and nonprofit providers can kind of open up a few more doors for you and have some more conversations where they probably have a little bit more to invest in technology solutions and might be a little bit more creative about it and be willing to have more of these conversations. The other thing that I thought about is if you go to the Fairfax County website and download healthcare trade associations, it's like a page and a half in 6-point font. There are so many of them. And I wonder if there are opportunities to offer, webinars or participate in something that they are doing at the right level of the organization to introduce yourself to more people there as another avenue.
Thank you. This is something which I had not thought of. So I really love that. Thank you, Christine.
Thanks, Christine. Tom.
Hey, Bobby, very good presentation. I like your approach. I think there's some really good things there. It's very logical and it makes sense. And I think, like if you're trying to find more, intros to healthcare companies, I think the one thing you didn't mention in some of the previous questions was about like having a referral program. And I think we got to remember in this day of the digital age, right? You got to go back to what's the best form of advertising and marketing ever? Word of mouth, right?
Word of mouth, yes.
So, kind of work through I'm assuming based on your knowledge, healthcare. You probably have tons of contacts across the healthcare industry. Come up with what makes sense for you in terms of referral program and incentivize some of your best contacts, the ones that you really trust the most, to try to work out there and help you as an agent, because I'm sure they believe in what you do and what you have, and I think there's really good product there. So I think that'll help a lot. And then in terms of the roles, I think definitely focus on like a chief administrative officer or a finance or operations manager, right? Because they want to look at the bottom line and trying to figure out how to, increase the, profitability or be able to expand their practice, right, without adding headcount. A lot of the other roles will be protective. Yeah.
Thank you, Tom. This is
Sure.
helpful.
Thanks, John Foster.
Great. Thank you. Prabhmeet, love the presentation, love the problem you're trying to solve because, boy, healthcare needs all the help it can get. One thought for you is a friend of mine actually builds urgent care offices. And one of the things he talks about is staffing challenges. And so from a development standpoint, operators like him, are building, a dozen offices. And it seems to me something like this can help from a staffing standpoint. So just thinking about that, I'll say the office developers or, urgent care developers. And I actually sent a text to him to see if I could do an introduction.
I would love that. Thank you, John. See, this is awesome. Like Tom says, get a referral, and here I have John giving me a referral. It's awesome. Thank you.
You're welcome.
Yeah, I'll build on that, Prabhmeet. I have a client that also does build outs for hospitals, right? So Children's Hospital, NIH, etc. So that may be an offering that could be done through a builder or designer versus finding someone in the hospital. I put a link to the National Association of School-Based Health Centers. I agree with Christine, like getting on the speaking calendar, trying to figure out if you can be a member, like how do you help do that advocating work. The other thing you might want to consider is certifications. So could you train healthcare administrators to get ongoing certification credits, like education credits, teaching them how to use this? And I don't know, sometimes that's a way to set a standard and have what you do become how hospitals should operate or healthcare centers should operate. Rose, you are up, and then I'm going to go to Reggie and James Lawson.
Thank you. Sorry, I'm hopping back in again. Okay, so now that I know kind of like the size and scale, my sister is one of the doctors at a urology practice. It's the last independent one down in the like below Northern Virginia area. But something she said that surprised me is they have free lunch every day from pharmaceutical reps. I thought that practice had died away. And you can tell me if this is like too much in the like yucky side of healthcare, but they get invited in. At least one doctor sits and talks to that drug rep. Like they all know at least one doctor has to sit and talk to that person, and then the whole team gets lunch. Like, if you want to be a non-scary augmentation to the front end staff or the back office staff, anyway, just a thought, but you can also say like that's the side of healthcare I'm trying to like stay away from.
No, you're right. I mean, whatever at least gives me the exposure and gives them the knowledge that it's out there, right? The technology is out there, and that's up to them. No, I appreciate that. Thank you, Rose.
All right, Reggie.
Yeah, great presentation. I kind of second the idea of taking the drug rep sort of model. I work with a nonprofit organization in the healthcare space, and you know, I'm a nonprofit, and I get approached by these organizations all the time, and you know that it still happens at hospitals. So it's a great way to get introduced to the type of people that you're looking to meet, and it's already kind of an accepted practice. I think you're bringing a different to it, but I think it would be welcomed. Maria put in the chat about the Medical Society of Northern Virginia. That's a great organization. They're based here in Tyson's, right at Office of Evolution. So you know, we can make an introduction there, and they could get you connected. And then my last thought was about having some type of proprietary data set or some knowledge that you can share, just information, but that is only you can provide about the problems that exist in healthcare and how your solutions help solve them. And maybe you can use that as a lead generation tool. If it's really helpful and useful, it will be passed around in the community, and you can get introductions made that way.
Thank you. Thank you, Reggie.
Thanks, Reggie. Back to James Lawson.
Thank you. So Prabhmeet, I want to circle back just real quickly to your 30-minute workshop. I can tell just from my experience, it feels like a big jump to go from nothing to that, like in one fell swoop. So there's a couple of things I want you to kind of think about, if you don't mind. One is you're getting a lot of information about referral programs and lunches, and there's a lot of different things that you can do. You got to think about how you can actually create an ecosystem around all of that stuff, right? They're not silos. Like, think of it as one complete system. So that's the first thing. The second thing is, I think you would do yourself a really big favor if you just created a 10-minute talk, right? I came up with a quick title: How Mid-Size Healthcare Companies Are Scaling Care Without Scaling Cost, right? And do a 10-minute on, listen, this is the problem you're facing. Here's how we're actually helping healthcare companies just like you, right, to extend care, increase care, however you want to phrase that, without actually scaling the cost of the business. And just do a 10-minute video.
Okay.
Slap it on the front of your website, and then post it every single week on LinkedIn. Just post it, actually 8 minutes. I think you're restricted to 8 minutes on LinkedIn, right? And just keep posting it, and then have that as a lead-in to something else that then leads to the workshop, right? Now, I know that just sounds like, well, that's too many steps. It's really not, because we've got to get people warmed up a little bit, right? But I would suggest you think a little bit about that. And I'm happy to kind of talk about how that might work as a system if you want to take the time to do it later. Anyway.
Thank you, James. I know you always have wonderful, brilliant ideas. I appreciate that.
All right, let's not, stroke the ego too much here. All right, James Lawson's pretty good. Let's not go crazy.
Well, Jen's awesome too. How's that?
No, I was not looking for any. No.
But right now on my screen, I see a lot of people on the bottom, but I see both of you on top, so I am going to take a screenshot of it.
One thing I wanted to say is, the National Association for Mental Illness, NAMI, is also a member at Mason Enterprise Center. And when I think about an organization that wants to extend its care without raising costs, where it's time sensitive, very urgent, and you may want to build in check-ins and all of that, they could be a great organization to speak to. And you already have someone like Eddie who can make that introduction. They have a conference in Atlanta. So I would also look at what conferences could you attend to meet people? Where could you apply to speak and get on the stage as well? But I think an organization like NAMI, and there may be others who are more open to, hey, I need something like this to scale because I'm dealing with something crazy and urgent, right? I don't mean crazy. I mean, just it's overwhelming and they're trying to help a lot of people. So I'll put a link to their website. But I think they're, I think of very mission-driven organizations who are absolutely willing to adopt something like this, innovative and allows them to scale their impact. Next up, Melinda.
Thank you, Jen.
Two thoughts, and it goes a little bit with Jen. I was going to suggest trade shows and events that have this kind of subject that they work with folks. And along with that, you could do focus groups. I did this for a client that was in the legal area and wanted to check out how to reach more folks that might be the perfect clients for them that they could help. You could do local focus groups with your current clients, asking them certain questions and then have a gift for them, maybe a $25 gift certificate, or I don't know what you would do, but have something you can give them. You can learn the most from your current clients, your current customers. And you could easily just do it digitally if you don't want to do it in person. Because of the DMV and, getting places and being places at certain times. But focus groups really you can learn a lot from. And if you can get in front of groups at trade shows and even have a booth there and have videos and other types of things, and maybe even a few of your customers that come to the event with you, again, it just makes it real personal.
So thank you for that, Melinda. If you can drop all of that in chat,
Yep.
that would be really helpful. If we keep our answers concise, it will be easier to remember for chat. So, otherwise, we would ask people, please put your ideas in chat in case we don't capture it quite the way you want us to. Rudenberg.
Thank you. And again, Prabhmeet, what you're doing is so cool. And it seems sticking in the college, university, nonprofit, community healthcare world, understanding what they currently use, because some of them have some level of scheduling and billing systems and all those kind of things. So in your messaging, as you develop it, how do you differentiate yourself? What are your thoughts about how you differentiate yourself in that segment, which I think is really a strong potential from what I'm listening in this group, because I'm ignorant about the field. But
So I
yeah,
understand your question correctly. You're saying how am I differentiating the student health centers, or how is Novamorph different for these student health centers? I'm trying to understand your question.
how your AI-driven functionality is going to be significantly different than what they're using now. And again, some may be manual systems.
Yeah.
Others, however, have billing and scheduling systems, because at least at this point, most of us are getting texts from our doctors reminding us.
Yes.
So,
So
yeah.
most of these, yes, I agree. So most of these systems that you talked about, the text that you see is once you already have an appointment scheduled, right?
Okay.
The other rescheduling and the other, well, some of the options, the EHR systems or the billing, whatever, the scheduling systems let you say, or reschedule or whatever. But I personally have struggled. I still need to make a call and say, I don't care which provider, just give me an appointment, right? Sometimes you don't see that option on your MyChart or whichever other portal you might be using.
Okay.
So for the students' health centers, the challenge usually is the walk-ins.
Yeah.
Because in our private or even like Inova, for example, which I know is big here at Northern Virginia, you walk in and you're going to wait hours and you may not even get to see the doctor that day. But for the student health centers, they want to make sure that the students are feeling better and they're getting back into their classes, and all the sports team are vaccinated and everything, and make sure they get their vaccinations. And trust me, from what I've heard from these medical assistants, those big football players, they are so scared of getting a vaccination shot that they don't want to show up. So they want somebody to hold their hand, literally do that. So those are some of the challenges which the admin staff is really facing, is how do you make sure that you're taking in all those patients? How do you care for them? And quite a few of this is manual. It's not as automated as we think it is. That is the challenge that I'm
Well,
seeing.
that's a terrific pain point to zero in on.
Yeah. Great. Thank you.
John. With that, I'm going to turn over to Michael Butera. And just a quick reminder, we only have a few minutes left. So for folks who haven't had a chance to jump in, we'd love to hear from you. Michael.
I'll be very quick. In the association community, if I were you, I would make a list of maybe, 10 to 15 associations, and I can help you with that. You want to talk directly with one of two people. You either want to talk directly to the chief executive, whoever that happens to be, or B, you want to talk to their event planner. Those are the people where you have a real opportunity to get in and make a pitch. And if you can put together a short little video instead of just an email to get started and follow that up with a call, I think that's a way to move that agenda. And I can help you with a list if you're interested. Just send me an email and I'll put a list together for you.
I will send you an email, Michael. Once I have your email address, I will hunt you down.
It's in the chat. It's in the chat.
Okay, perfect. Thank you.
Thank you, Michael. Mike.
Hi, how's it going? Great presentation, by the way. I think a great opportunity is looking into the VA. They are critically understaffed all the time. Wait times are ridiculous. And funny enough, they're kind of apt to, I don't know, be more technically inclined. I'm more worried about the runaway costs of the multi-agent approach. That seems really interesting now. I don't know.
Yes, so that's the part. We know that there's going to be a cost for putting the system in, but we have to look at the ROI of hiring a person versus putting the system in. And then, with the growth, the chart that I have mapped is like, if your growth is like this, your costs are going up like that, right? So very, very close. But if you have, sorry, I'm probably reverse on your screen, but you know what I'm saying. I'm trying to draw a chart with my hands here. Thank you. Thank you, Mike. I appreciate the idea of VA. I had not explored that yet. So thank you.
They're really easy to get in contact with. There's a million people you can reach out to at the VA for it.
I will lean into you and ask you if you have any contacts. I will reach out and talk to you about this offline. Okay.
All right.
Thank you, Mike.
Probably one of the things we haven't talked about is LinkedIn.
Yes.
And so just as you're putting together this video or different pieces of content, I would definitely consider doing targeted ads through LinkedIn. I might also look at any publications that sort of healthcare specific organizations use, read, etc. And one other question I had for you, because you're part of the Harvard sort of data program, like, have you talked to them about doing a case study on campus?
I haven't thought of having a case study with them, but that would be a brilliant idea. I can reach out.
I find working with wherever we go to for school can often open doors we didn't think about, whether it's just to try something or focus group, or that's a way to get data.
Yes, thank you. I will reach out to them.
All right. Any last minute questions? I'm going to turn it back over to James Lawson to take us through what's coming next. And I think his first question for me is going to be for you. So be ready.
So what you can help me today with? I know, James, you were supposed to say you're muted, so I'm going to take that question myself.
Yeah, I got it. I couldn't find the microphone. Yes. What else can our 1 Million Cups community help you with today, Prabhmeet?
First off, I want to thank you all for the brilliant, awesome ideas. And it's not just you, James. Sorry to take the steal thunder away from you. It's everybody else also. So I'm sorry. but I mean, some of the opportunities I had not thought of, like the nonprofits and reaching out on the Fairfax County website itself or the VA. So I really, really appreciate that. In terms of associations and videos, and I know I don't like to hear myself on the video, but I think I will have to tough it out and do that. What else you can help me with is keep pushing me and keep supporting all the other people you have been doing so far. So I really, really appreciate this community. Thank you very much.
Awesome. Very well done. Very well done. Okay, so next week's presenter will be our hybrid meeting, right, over at George Mason in Eton. Thomas Radley, my computer guy, will be presenting for us. And by the way, the next could be you. So what we want to stress or emphasize with you guys is, look, come in here. You've been here. You can see it's fun, right? This is not an arduous task, right? Getting in front of all of us. We like to look at it as being low stakes stress testing. Right? Get the community feedback. And by the way, you build your network. 3 really good reasons to get your face in front of the screen and present, as Prabhmeet just did for the second time. So some upcoming events, there's a whole bunch. We will put this in the chat, right? As soon as I'm done, I'll copy and paste it. But yeah, we're in DMV, guys. There's no end of things going on. I don't know if there's anything in there specifically, Jen, that you want to shout out about, or...
I would love to shout out about May 6th, next Tuesday. It is Small Business Week. We will be at the Small Business Expo with Fairfax County EDA. You can come see us in person. We can give swag. We can sign swag. We're there for you at the 1 Million Cups table. So come check us out. But there will also be lots of other businesses there. So if you want to expand your network, consider attending that event. It is all day. I'll put a link in chat so you can learn more about it.
Awesome. Thank you, Jen. So schedule, as I said, next week we've got Thomas, then May 13th, Dawson Bauer, Andrew Kolsky, and then Tom Nafor. So we've got a whole schedule through May. This is amazing. If you want to jump in for June, let us know. We'll get you on the schedule, right? So we'll say all the links are in one place. You can scan the QR code, share what we're doing here with your network, please. There are people like you out there who I think would benefit from being part of the 1 Million Cups community. Get them involved, get them here. And we would love to see them. So stick around for a minute or two if you can. Prabhmeet, once again, thank you so much for your presentation. Yeah, we love you dearly, and that was really very, very cool. So thank you so much. I will